Hello! Are you planning on going on a fun tropical vacation? If you're planning on going to Costa Rica, Peru, Belize, Latin America, Southeast Asia, and or the South Pacific, you should be aware of the dengue virus. That way you can protect yourself and still have a good time. There's over 100 different countries at risk, and with rising temperatures, the risk is now greater than ever. So here are a few tips and tricks to help protect yourself and still have fun on vacation. Alrighty, now let's head on over to our expert on the dengue virus.
Thanks, Ryan. The dengue virus is transmitted by the Aedes aegypti, or the Aedes albopictus mosquito. 400 million people get infected every year. Of those 400 million, 100 million show symptoms, and 22,000 die every year. Watch out.
There are some important items to include on your packing list to keep yourself safe from this virus. The most important item is insect repellent. However, make sure that if you're also wearing sunscreen, you apply the insect repellent on top of the sunscreen to prevent the repellent from rubbing off. Also, make sure to pack long-sleeve shirts and pants to limit skin exposure. This is a good example of what to wear on your vacation. Wearing short-sleeve shirts and shorts will increase your susceptibility to mosquito bites and the virus.
Now let's go to our medical expert to see some common symptoms of the dengue virus.
Alright, so some of the most common symptoms of dengue virus are nausea and vomiting, rash, aches and pains, especially of the eye, muscle, joint, or bone, and fever. Over here we see the most severe symptoms. If you have these symptoms, definitely go to a doctor. So this occurs in 1 of 20 people. You can get a shock, so dengue shock syndrome, internal bleeding, vomiting, abdominal tenderness, bleeding from the nose or gums, or bloody stool or vomiting blood. Again, definitely go to a doctor if you have this.
Here are some examples of the hemorrhaging of the eyes and nose that can occur while you have severe symptoms of the dengue virus. These mosquitoes can most commonly be found around still water. They are able to smell the CO2 emitted from your breath from anywhere from 10 to 50 meters away. As soon as a mosquito that is infected with dengue virus bites you, this creates a passageway for the virus to enter your body and infect you. And once the virus is inside your body, it isn't before long until it starts making its genome part of your genome. If you've been infected with dengue virus and are concerned about transmitting it to your family and loved ones, don't worry. You can only get dengue virus through being bitten by infected mosquitoes. If you're a pet enthusiast out there and you're worried about your pet contracting the dengue virus from an infected mosquito, don't worry. Humans are the only animals that contract the harmful dengue virus. If you're not really familiar with what a mosquito bite looks like, or you're just not quite sure if you've been by a mosquito, here's a prime example of what one looks like. Usually inflammation occurs, it gets red, and then itchiness develops.
If you think you have dengue virus, there is no cure, but there are some things you can do to treat the symptoms. You need to make sure you get lots of rest, take acetaminophen to control the fever and pain, and hydrate, drink lots of fluids.
That being said, if you do think you have it, do not take ibuprofen as it increases the risk of bleeding, and do not ignore the symptoms. Go get evaluated for your symptoms right away.
Now that you know a little bit more about dengue virus, you can feel more safe about going on your nice tropical vacation. So next time you're out there, be sure to apply sunscreen, bug spray, and to wear long sleeves. And just remember, with dengue virus, some of the common symptoms are fever, aches and pains, and rash. Symptoms last usually 2 to 7 days, but some of the time it's just asymptomatic. Thank you, and as always, stay classy.